I would like to welcome everybody to today's webinar titled CliniSync Notification Services and the Condition of Participation on Notification for Admission and Discharges. Today's presenter will be Dave Zupkovich, who's the Application and Web Services Manager. My name is Scott Mash, and I'll be serving as the webinar host to make sure things flow great and we keep an eye out for questions and whatnot, but we will take the time at the end to answer every single question. With that, I'm going to turn it over to Dave to get us started. Dave, the floor is yours.
Thanks, Scott, for passing the mic over. I'd like to welcome everyone to our webinar today. Thank you for spending some time with us. Today, CliniSync is going to be going over the notification services that we offer, as well as their relation to the condition of participation on notifications for admissions and discharges. Now, if some of you were on our webinar this past Tuesday, you would have been briefed a little bit more on the actual rule itself and a little bit more behind the compliance and legality of the act and a little bit more on CMS's rules. Today, I did want to just mention that we will be going over just the technical aspects of the CliniSync notification services. So we're going to be working with a demonstration of our Notify tool today and kind of give you guys a little bit more of an overview of how that looks and how the actual application works. So what we're going to do is just move right along here, and as Scott mentioned, we will be taking questions after the presentation. So why CliniSync? So hospitals use CliniSync to meet the CMS requirement of alert, discharge, and transfer notification delivery. And as we mentioned, we went over that on Tuesday's webinar regarding the 21st Century Cures Act. So this act is going into effect. It will be effective May 2021. So this is a little bit of a preemptive introduction to how CliniSync can help you reach those goals. So these notifications to our community are sent thousands of times a day to various treating providers. Over 12 months, we've delivered over 27 million notifications. So there's quite a lot of traffic that is going through. And as stated in the Cures Act, hospitals must send notifications to those recipients that need to receive notification of the patient's status for treatment, care coordination, or quality improvement purposes. So CliniSync notification services can allow hospitals to satisfy these requirements. The two products that we have that make up CliniSync's notification services are Notify and Clinical Dispatcher, both of which are tools that can be leveraged for clients to obtain notifications on their specific population of patients. They are a little bit different. Notify is a subscription-based web service that allows the organizations to track a patient population that is submitted through what we call a patient panel or a patient registry. So that panel then acts as somewhat of a filter to all of the ADT data that is coming in from our contributing facilities. If there is a match that is made, a notification is generated, and that notification is delivered through a subscription right into the user's profile. So this provides ADT event notifications from all of our contributing facilities. So that includes hospitals and health systems. And we do have a variety of delivery channels that act on behalf of Notify as well. So we can, send notifications through the web portal itself. We also have the ability to set users up with a direct secure email address that will include actually patient information in a secure encrypted email. We can also set users up with standard email delivery. So that will just provide an alert to their work email inbox, let them know that they have an alert that they can check out. We could even text your phone. We have the ability to send an alert directly to your cell phone. So there are a variety of different ways in which these notifications can arrive to you. Now, on the flip side of that, Clinical Dispatcher is the other product that we offer within the notification service stack. And it kind of acts as, you could say, a big brother to Notify. It's a much more integrated solution that is quite robust, and Dispatcher has the ability to deliver this data in near real time using kind of the same active population list, although it's a little bit more descriptive. And what it does is it matches against the data that is coming in, but instead of sending just an overview notification, kind of like a snapshot, it actually sends the flat file alert to either an SFTP location, or it is pulled in directly through into the system via like a VPN tunnel. So this matches the patient to our CMPI, our Community Master Patient Index, and then that's routed directly back to the client. So this is a much more integrated solution, and typically it is something that we reserve for clients who are dealing with very, very large populations of patients, payers, things of that nature. So we aren't going to be doing a demonstration of that today just because it is more of an integrated solution, but I did want to mention that as well. So Notify. Delving a little bit deeper into the Notify application, as I've mentioned, it is a web-based solution, and this allows users to subscribe to a specific organization's patient panel or registry. So as I mentioned, these panels, they act as a filter to the ADT data that is coming in, and practices are responsible for uploading their active patient panel. So we do have both a manual process as well as a more automated solution via API delivery. So we can set users up with a delivery agent that will pick their panel up from a secure file location. So those panels act as a filter in Notify to be the criteria for matches. Why do we suggest Notify? That is because physicians can initiate timely care management, improve patient follow-up and outreach, decrease the amount of readmissions to the hospital ER, and combine clinical data and claim history to identify patients at risk. Notify does this by matching the patients listed in the active patient panel or registry to that ADT that's coming in. And then, as I've mentioned, those subscriptions that are quite customizable will receive those alerts and alert the user. So we'll be going over that, and as I mentioned down there, just the variety of different ways in which those alerts can be delivered. So now we're actually going to tap into the Notify application and complete a demonstration. So I will go ahead and move this out of here. And on my screen right now, what you are looking at is the home page for the Notify web portal. So much like many other applications that you use, you will have a username and a password, and users can just populate this. And what we'll do is log in. And once we log into Notify, we are going to be brought directly to the user notification work list. So every time you log in, you will be greeted to this home screen where it will tell you that these are, of course, my notifications. So all of your alerts will populate here. And you can see within this work list, it's actually comprised of 8 columns that the data is broken up into. So we have data for the date that the alert was received, the first name of the patient, last name of the patient, gender, date of birth, source facility, so where the alert was coming from, the event type that the alert is for, as well as the event date, or when the date occurred actually. So based on these columns, we can actually filter and customize this list to display information that is pertinent to what we're looking to do at the moment. So for example, there's a variety of filters that can be applied, and we'll kind of go through those, and I'll explain how this list can be customized. The first thing that I wanted to mention is this section up here in the upper left-hand corner. We have 2 date boxes. And when you log in to Notify, you're going to notice that it's going to display data for the last 7 days. So this is showing me all of my alerts between September 17th and September 24th. Now, this doesn't mean that I am limited to only 7 days of data at a time. I actually have the ability to go all the way back for a total of 62 days, or about 2 months. And you can see as I do that, my list will expand to display some of the notifications that fit outside of that week window. I can even go into a 24-hour period of time. So let's say I wanted to display data from the 21st to the 22nd. That would just display the alerts that I've received within a 24-hour window. So that is one example of the filter that can be applied to Notify to narrow down some of the data in your view to make sure that you are only viewing data that you are looking for. Next, we have a list here, and this is an expandable list. You can see currently it's set to all source facilities. Now, source facility, as I mentioned in Notify, is one of our contributing hospitals or health systems that we have providing ADT data into the HIE. Users in Notify have the ability to select an individual hospital sensor that they would like to see alerts from. And when you log in, you'll notice that this list was set default to display data from all of my source facilities. As you can tell, we have over 137 different contributing facilities within Notify, and this list can grow quite large. So sometimes it is helpful to just narrow down to a specific data source. So any one of the hospitals that we have in this list or health systems, you can choose and select, and that will only display data from there. Since I'm using a test user, I only have data from a test environment, but you can kind of see that it would look like this if I were to just select that hospital name or health system name from this list here. Moving over, we have another menu which we can use as a filter, and this is actually a filter for the event types. Now, as I mentioned, Notify breaks data into a variety of different event types in which we can kind of see what is this alert for, right? So the ADT data that we're getting is broken up into either one of 8 different event types. So we have ambulatory admit, emergency admit and discharge, encounter update, we have inpatient admit, discharge and transfer, and then we have patient death as well. So based on the information that you're looking for, you could select any combination of these to display data that is only related to the event type that you have selected. So for example, if you wanted to look at inpatient admissions, you would select inpatient admission, and that would only bring up the admissions. Actually, we also have readmissions in here as well, but that would only bring up the information related to that. Similarly, if you wanted to look at emergency room admissions, you could just pick that, and that would only display the emergency room admissions. So what's cool is each one of these filters, the date range, source facility, and the inpatient transfer event type, or whatever event type you have selected, can all be compiled on top of one another to actually give you a very, very specific look at your alerts. So if you wanted to, you could pick a certain date window for alerts coming from Cleveland Clinic, and then have just emergency room discharges included on there. So it is quite customizable, and you are always free to play around with that. Now over to the right of the event type menu, we have another menu which we could open and expand here. And this is actually, it might sound a little redundant, but this is just a different way in which you can view the data. So this is actually what we call a grouping feature. So it's not so much of a filter as these are, but more of a group. You'll notice that I can group by the date received, group by event type. I could group by the patient's first or last name, and I could group by the source facility. So for example, if I wanted to group by the date received, let me go back here. I could click this option, and what it's actually going to do is provide me a list of dates on which my notifications came in. So instead of selecting the date range via the 2 windows here, like a specific starting point and an end point, I can just group by the date received, and that'll provide all of the dates that I had notifications for, which I could expand. So it's just a different way of getting the data. If I wanted to, I could just open up all of these, and it would be the same thing as selecting the date range that the alerts are for. But if you're looking for a specific date, and you have a date in mind, you can do that. Or if you're looking for even like a patient first name or something like that, and you have a specific name in mind, you could pull that up. So there's a variety of different ways in which the group can be applied. Now, I'm going to draw your attention over to the right-hand side of the screen here. You'll notice that we have a button that says Export the Work List. If you click this button, it does exactly that. This will export your work list directly into Excel, which is an extremely beneficial tool if you're someone like me who spends a lot of time looking at data in Excel and is used to running various tables and formulas that can aid in the way that I go through data. So it's pretty helpful, and you'll notice that all of the columns that we see on the screen here, okay, so everything that you see on the screen is actually retained in a nice formatted Excel column. So we have the date received, we have the read by and acknowledged, so we'll get to that in a minute, but we have the first name, last name, gender, date of birth, we have source facility available, the event type, and the event date. So now if you wanted to, you could apply any variety of filters to your Excel file and make it a little bit easier to sift through. And one thing that I really like about this too is that you're able to save your progress, right? And that's really important if you're someone who doesn't necessarily need to go in and notify every single day. So maybe your workflow for your company kind of requires you to just export your work list once a week and sift through your notifications at your own speed, or maybe you have a small population that you are tracking and you don't really need to go in and sign in every single day. It's really helpful to export these work lists, and you can kind of save them and do that, save your progress or color code them, whatever the case may be. You can even get further customizable in Excel. So that is a very beneficial tool that we have, and that is found right there. Now going to the next line here, I will mention a few of these other options that we have available to click on. One is the subscriptions menu. So as I mentioned, Notify facilitates the delivery of alerts through the subscriptions. And one way that you can kind of think about the architecture of the application is by calling to mind a memory of having like a subscription to a magazine, right? So, for example, I month after month get a subscription, a new issue of National Geographic. So National Geographic in this case would be, my patient panel, okay? And month after month they send me, whatever the new information is that relates to the publication. Notify works very similarly, but it's not just saying that I can only have one magazine subscription, that's delivering information to me. I could have multiple. So if your organization chooses to break apart your patient population, and maybe you have a patient panel that is directly related to pediatric patients, and then you have another patient panel that is just orthopedic patients or diabetes or high risk, whatever the case may be, whatever the however your patient panel is broken up or your population is broken up to track, you can have your users have multiple subscriptions to each one. Now, more often than not, I will say that a lot of our clients just kind of put their patient population in one panel and they track that, and it's very easy because each user has one subscription and it's very easy to manage. However, we do have clients that are set up in very unique ways, and it makes more sense for them to have their populations broken up into a variety of different ways in which their users can just have a subscription to one specific population or one subpopulation of their larger group. So if they have multiple subscriptions, your users will be able to choose which subscription they would like to see. And when you log in, it's going to just show notifications from all of your subscriptions, or if you just have one subscription, it's just going to display that. But if you have multiple ones, you can choose which subscription you would like to look at. As you can see, I chose another one that I have, and that impacted the information that is down here because I don't have any alerts for it. So that is one further way in which you can kind of dig through your data if your organization has multiple patient panels. And last but not least, we have a patient first and last name search box. So if we are looking for someone specific, we can just type in their name, and that will just bring up any notifications pertaining to them. So let's actually take a second to examine this list a little bit further and actually then click into one of these alerts. So as I've mentioned, the work list itself is broken up into 8 different columns: date received, first/, gender, date of birth, source, facility, event, and event date. Now you'll notice though that in the date received column, your eyes are drawn to these little tiny icons that we have placed in there, right? We have little green R's and little green A's. And I apologize if it's a little small. I don't know what it looks like when sharing the screen, but that's what those are, is little R's and little A's. And what those stand for are either read or acknowledged. And we have a variety of different icons, little baby graphics that populate the web portal. You can actually always figure out what those are if you ever forget by clicking on this permanent hyperlink here in the bottom left-hand corner. And it says View Legend. You'll notice if I click that, it brings up a legend of the icons that we offer in Notify. And I'll just quickly go through those. The first of which is a little black star, a little black asterisk. That means that if you see that, the notification you are looking at is indeed a test audit, or it's a test notification. And for whatever reason, CliniSync and our technology vendor Health Catalyst, we're doing some testing. Now, 98% of the time, you'll never ever see that. We don't really do test audits too frequently. But if you ever do see a little black asterisk, that's what it is. If you are looking at some text and it is bolded, and you can tell that it's very different from just plain text, that means the notification is, of course, new, or it's unread, it hasn't been clicked on yet. If you start to see that little green R, that means the alert that you are looking at has either been opened by you in the past at some point, or if you're an administrator, it's been opened by someone in your organization. So that's basically red, just is the equivalent of opened. And similarly, acknowledged will appear next to the R if the alert has been indeed acknowledged or signed off on. And that's just a different way of putting like a checkbox next to the alert. So those icons are just placed in the application to kind of help you sift through the clutter and just remember, okay, last time I was in here, Alyssa Armanto, she had an alert and I read and acknowledged it, so I don't need to click on that alert again. I already did what I needed to do for that specific patient. So all those icons are in there is to just help you sift through the data a little bit. But let's actually go and what we'll do is we'll just take a look into one of these alerts. So I'm gonna go click into an alert here for Mr. Perry Mason. And this came in on the 21st, got the first and last in there, gender, date of birth. This is coming from Group Medical Center, our demo hospital. And this was an inpatient admission. So I'm gonna go ahead and click on this alert for Mr. Mason. What that does is it brings me directly into the notification itself. Now, every single notification, regardless of what event type it is, where it's coming from, or whatever the case may be, they're all structured in the same way. Okay, each notification is comprised of 3 different tabs, and those can be found here on the left-hand side in this gray menu. They are the notification tab, which basically serves as a snapshot of everything we know at the moment. It's kind of a standardized template that just puts in most of the very crucial elements of the HL7 message that was sent to us into a template for you to, kind of digest and look at and pull apart what you need. So that is the notification tab. We then have the event data tab and the audit tab. The event data tab is just a tab that includes a little bit deeper look into the data itself. So if there's any outlying, patient identifiers or various provider codes that were included in the HL7, but they weren't right at the forefront of everything that was crucial to the alert and to the, specific encounter, maybe they weren't included in the snapshot here, but you can always obtain that through the event data tab. So we'll get to that though, and we'll get to the audit tab as well, which is just basically a audit of the alert, but what I wanted to spend most of our time focusing on within the alert is the notification tab. As I mentioned, this is the default tab for a reason. It's probably the most important tab, and frankly, it's the one that you'll likely be spending the most time on. This tab basically tells us, everything we need to know about, this alert at this given time. So we have the message control ID, the event time, event type, admit date, facility code, patient's first, last, date of birth, and gender, and then the patient class. So this whole chunk here, I'll highlight it. These are the basic criteria that need to be met for the alert to generate in the first place. That being said, this is always going to be populated with information. However, once you get below patient class and you start to kind of get into hospital service all the way down here to like primary insurance plan, you start to deal with some fields that are not necessarily required by us for the alert to come through. So because of that, as you can see, there's some fields here that actually don't have any values populated. We don't really have an admit type here or an admit source. We don't have a working diagnosis code. We can see though that this patient was admitted for a description of dementia. We don't have a final though. We don't have the admitting or attending provider, although we do have a PCP name there. Don't have consulting or referring. We do have quite a bit of demographic information on this patient, so the address and phone would populate there, as well as the patient's facility MRN, patient account number, servicing facility, patient assigned location, some of those additional fields that you may not need, but they're there in the event that you do. So based on this, though, we can get a pretty good idea of why this patient was admitted as an inpatient. So based on that, we may have everything we need, we may not. In the event that there's still something that you're looking for on this patient, so maybe you're curious as to, okay, we've seen this patient in the past. I want to take a deeper look into their medical history. CliniSync has allowed for a link between Notify and a separate application that we actually offer. It's not a part of the notification services, although it can serve as an aid, and that is the CliniSync Community Health Record, or CHR. Now, the CHR is basically a historical place where all of this patient's information from any of our contributing hospitals is included into a well-structured patient chart. And if you have an account in the Community Health Record and in Notify, the applications can actually talk to one another, and it can bounce you directly into this patient's chart. So just by clicking that, what happens is you can be brought directly into the patient's chart, and now you are able to see, not only a patient summary for them, and each of that, all the three most recent events for each one of these categories. So care summaries, reports, results, medications, allergies, procedures, they would all display, but you could actually dive into each one of those categories as well. For example, and I apologize, I don't have too much data for this patient. Of course, they're not a real person, but for encounters, you can have a complete list of their encounter history. That can also be filtered by inpatient, outpatient, emergency room. You can even go back into all records, the entire history. It's going to default to show you the last year, but we have the ability to delve a little bit deeper into results as well. So now you're not just limited to looking at the patient's ADT data. You'd also be able to display labs, RADs, trans, various different result types. We have a medications tab, which would allow you to participate in some prescription monitoring. So we can actually query ORs and sift through that information as well. And we also have the ability to look at any documents pertaining to this patient. So for example, if they're a member of like VA, we could query any external documents that may exist. We could also create our own documents too, and any documents that have been created on this patient would populate here. And then, we also even have a closed loop referral system, which is a really cool tool in which users can create a patient referral and send that off. So the CHR is an extremely robust application. It is a separate application, so we're not going to focus directly on that, but just know that if there is ever any more information for a patient that you're looking for, and it's not obtainable in Notify, you can always bounce directly into the CHR. Over to the right of that, we have another button, which is just that acknowledge button, just that sign off button that I mentioned. We'll save that for last. We still got some work to do, but you could click that there when you're done. So that's kind of a basic overview of the first tab, the notification tab. I'm going to actually scroll down and move to the event data tab, which is the second part of every notification. Now, the event data tab, as I mentioned, is just a tab that contains some additional data features that we didn't place directly right in front of you when you first clicked into the alert, but they are available, of course, if you ever need them. The event data tab is broken up into two columns. There's the field column, and then the next column is actually the corresponding values to each of those fields. Now, this page can be filtered either alphabetically by fields. You can have, if you're looking for a specific field that you need something for, you can find it alphabetically, or you can do what I like to do and sift it through which fields actually have values attributed to them. So it's not going to come alphabetically, but at least you pull up all of the fields that actually contain a value, as opposed to a lot of these blank fields that we don't have anything for. So, as I've mentioned, this is just an additional look at the data. We have certain added fields like the marital status. You can see we have an S for like single or never married. Of course, the patient's name. We have that admit reason description. But we do start to see some of this other identifiers, such as the community master patient index, various identifiers and IDs, this patient IDs that have followed the patient, address, city. We have like patient's language. We also have like race, religion, some additional just demographic fields for the patient. But really what's the bread and butter of this page is this section here. You'll notice that it says formatted event data. Now, formatted event data, unlike a lot of the other values that exist on this page, is actually a hyperlink, which you could click on, and that's actually going to download the raw HL7 message directly to your computer. So as this, you'd basically be getting the flat file, the same flat file that CliniSync has received from the hospital. You can obtain that and take that in directly. So if you ever need that for some reason, whether it's your vendor would like to look at how a message is structured from a certain place, or whatever the case may be, you can always obtain that from the event data tab. Now, moving on, last but not least, we have the audit tab. And the audit tab is exactly what it says it is, just an audit of the actual notification itself. So, of course, we're able to see where it's coming from, what type of sensor it was sent on, what alert it is for. Much of this information you would already know by this point, but it's just there to let you know certain timestamps that are associated with the alert. You can see it was sent from the hospital sensor on the 21st at 12:54. Notify received that a little over a minute later, 12:55:56. And those times are pretty true to what you're actually going to see in our live environment. Most notifications come through in near real time. So generally, as soon as CliniSync is aware of patient activity, you will be as well. Scrolling on down, we have subscription details, which contains just some information as to why this alert matched to your specific, subscription and what subscription it matched for. So if you ever need a reason why you've received this alert, you can always click on the audit and it'll tell you exactly why. Once we're done examining that, we could go back to the notification tab itself and just click acknowledge. That's going to tell us that at 1:37 on September 24th, we have acknowledged this alert. Now, to see the little R and the little green A that should be next to the dates here, you'll notice that when I go back home, I now have visibility of both of those two items next to the date. And so the text is no longer bolded as well. So next time I log in, I would be able to know that, okay, I've already clicked on this alert. It's not a duplicate or anything. I've already done what I needed to do for that. And to be honest, that pretty much makes up a basic overview of the Notify application. So generally, it's just 2 screens, and we have the work list, and then each corresponding notification has its own little environment that you can sift through. So that is a demonstration of Notify. Now I'm going to move back to the presentation here. Oops, a little too fast. So that was our demonstration. Moving along with today's webinar, I also wanted to provide a little bit more information on Clinical Dispatcher, as it is something that I mentioned we can't necessarily demonstrate, but it is a process that enriches a practice's clinical data and sends back the HL7 message directly to the practice or organization. As I mentioned previously, this is a service that is really beneficial to larger populations. And it's more integrated. So, if you are just a smaller practice, this may not be something that is super helpful to you. And it does, it works though by using kind of the same active population list that Notify does, although it does include the patient's internal ID. So there's a few more extra fields that we don't need in Notify. It's a little bit more descriptive of each patient. But these lists are submitted to CliniSync, and they're stored in a data repository. And basically, it's 100% automated. So once these patients are processed into our system, they're automatically referenced against our master patient index. And if there is an alert, or if there is a match, an alert will be generated and sent back to the practice. So the message, the returning HL7 will be sent back directly. So as I mentioned, it is much more integrated, but it does come at a different cost as well. If you are interested in Clinical Dispatcher, we would be able to have a separate conversation with that. You could always reach out to your CliniSync representative. There is a difference between the two, though. Notify, of course, as I mentioned, web-based. Users are getting their alerts through individual subscriptions. It's much more beneficial for the actual person, not so much the organization as a whole, but it caters more to an individual experience. And it does have a cap on each patient population panel as well. Notify does not accept anything larger than 40,000 patient lives per panel, but it does have the various delivery methods. Clinical Dispatcher, though, as I mentioned, the main difference is that it is for those bigger practices. So if you're dealing with anything bigger than 40,000, millions, hundreds of thousands of patients, you'd be able to store all of them using the dispatcher process. So that is a little bit of a comparison between the two notification services that CliniSync offers. Now at this time, I figured I'd pass it back to Scott, and we could tag team a Q&A session. If you guys do have any questions, please feel free to ask, and Scott, you can facilitate that.
Yep, so if you do have questions, please go ahead and enter them into the question box or into the chat box. We'll find them in either place. So Dave, we do got quite a few questions here, buddy. You ready to get rolling?
Yeah, let's get to it.
All right, within my notifications, can I create a default filter? And I think what they're asking here is if I set up a default filter and I log out, log back in, will I have that default filter presented to me again when I log back in?
Great question. Unfortunately, the answer is no. Notify is not something that can save your progress or your defaults. However, that is where the Excel file comes in. So if there is like a template or a set of filters that you prefer to use or you wish you could have every time you log in, my recommendation would be to export that work list, set that template up in Excel, and you'd be able to kind of customize each export into that template. Scott, is there another question we have there?
Oh, yes, there was, and I was on mute talking away.
Oh,
sorry.
sorry.
All right, next question. To meet the notification requirement, does it require the physician office to be subscribed to Notify? In other words, if the hospital has Notify and sends out the notifications, but the provider's office isn't subscribed with Notify, does the hospital meet the requirement of sending the notification? And Dave, I can take that question.
Okay.
The answer, in short, is yes. The hospital will still meet the requirements of the condition of participation, but it does, CMS uses the term best effort quite often throughout the condition of participation language. And what that means is the hospital has to do their best effort to market to their surrounding providers, to the surrounding long-term care providers, that they are utilizing the CliniSync HIE network and should subscribe there. So even if there's nobody to receive your alerts, if you're sending them out and you've done your best job to let folks know what the service is, then you've met that condition of participation. All right, next question. If I have Notify, what would happen if I exceed the 40,000 patients? Do I stop getting messages? Is there a way to break things up so I can exceed that 40,000 patient ceiling?
Great question. So to answer your question, if you had more than 40,000 patients in a patient panel, what would happen is Notify would turn into a complete snail. It would move extremely slowly, and it would actually start not necessarily matching in near real time. It becomes very clunky. So that's why we put that 40,000 cap on there. To combat that, the best way in which you can kind of navigate around is to break your population up into a subgroup that makes the most sense. So, you know, we've seen it all. We have clients who have one panel of males, one panel of females, or they've color-coded panels and broken it up alphabetically. So maybe they've done panel red or panel green or panel A through L. And M through Z, you know, whatever the case may be, there is a multitude of ways in which they can be broken up. But it's not to say that your organization can't have more than 40,000 as a whole. Those 40,000 in Notify just can't exist on one specific panel. So.
Perfect. Next question. Does Notify send out alerts for treatment for ambulatory visits, outpatient visits?
Yeah, another great question. So if you recall, when we were going through the event types, I did mention that there was a event type category called ambulatory admit. Now, ambulatory admit is a bit tricky because it's not just admit, okay? It also has the ability to include observations. Basically, anything that isn't related to inpatient or emergency would be considered like an ambulatory admit if we're receiving the alert, if it's coded that way. Similarly, it's important to note that though we do have quite a large group of contributing facilities, not all of them code their messages the same way. So we do have some hospitals or health systems that choose to send messages with like a ambulatory setting, like an AMB code, as opposed to like an ER code. So it does kind of become tricky. You know, we have looked at expanding the event type category in the past, and it's important to note that we're always taking suggestions for Notify to make the application a little bit better, although it does kind of get tricky once you get into the outpatient category of looking for data. So I don't want to say definitely that you're always going to be able to have access to that, but if the hospital or health system is contributing that data and it is not an emergency or inpatient activity, it will likely be included in the ambulatory admit event type, which your subscription can be set up for.
Okay, next question, Dave. Is the patient panel cleared out after a certain period of time, or how often must the panel be updated?
Fantastic question. So the first part of that question is no, it will never be cleared out if no action is taken. It will just continue to use that same group of patients to monitor again and again. And if there's ever a match, it will continue to generate alerts. That being said, though, we do have a rule that each panel must be uploaded or refreshed, I suppose, once every 2 years. Now, that's a little bit long, and most of our clients upload a new panel weekly, if not, bi-weekly or even sometimes daily, depending on the workflow. But there is a rule too that each patient that ever exists in your panel at any given time must be meeting the criteria that we have. So they must have an existing relationship with you as the participating organization. They also, must be enrolled in some sort of a care management program or some reason as to why they are included in your population that you're tracking.
Awesome, thank you, Dave. Next question. Is there a way to add the contributor's unique identifier, such as their MPI, to the Notify application?
Yes, there is a way that we can do that. So one thing that we've been talking about a lot today in the demonstration is matching off patient panel. So that is our number one way that we prefer matches to be made within Notify, but it is not the only way. We do have the ability to add a additional filter in there for certain clients who would be looking to match only off specific providers. So what we're able to do is we can provision a subscription to only provide alerts that are matching to a provider's MPI. Now, basically that means if we're receiving an alert and the provider MPI is included in there, and it's set up as criteria for matching, an alert will be generated. However, the flip side of that is, we can't always guarantee that that provider code can be in there. As you've seen when we've clicked on that alert for Perry Mason, there were provider codes that were not included. So, if you do that and you choose to match off the MPI, it does have a potential to narrow your match pool a little bit. So, one thing that we've seen in the past is have a organization that has someone who, has a patient panel subscription that is matching on everything, and then they also may have a separate subscription that is only filtered based off the MPI. So we do have the ability to do that. Yes, it can be a little bit tricky though, so we always want to just make sure that we talk about that with the client prior.
Perfect, thank you, sir. Next question. The Notify demo that you provided is what the provider does on their side to receive the alerts, correct? Or, they're asking that question. And then they also follow up, is the hospital sending the alert required to upload a panel or do any additional steps for the alert to be sent out?
So the answer to that is, again, two-part. The first part, yes, it is the provider side of things, the care coordinator. So it's not necessarily just like the hospital that would have access to Notify. Notify is meant to provide alerts from the hospital to those who need them. The hospital, though, is not required to have Notify, I don't believe. And Scott, you could correct me legally if I'm wrong in that, but they're just required to be sending the ADT data to us. So they must be
correct.
Yeah,
the configuration, the alerts that we're already receiving from the hospital interfaces, actually it meets the requirement at the base of the requirement, though there is some additional steps that the hospital should take around marketing that feature and some internal documentation as well.
Mm-hmm. Yeah. So it's not a requirement that they are built in Notify as like their own account. They don't need to upload a panel or anything like that. They just need to keep doing what they do and send the alerts, and then the practice side will be the ones who upload the panel that they want to track patients on. So.
Yeah, and also just to add to that a hospital that is sending the alerts may want to leverage Notify to receive alerts for their employed physicians. Even, maybe they want to use Notify to even monitor their own admissions. Use that as a tool to alert their internal physicians of an internal admission if that's not supported within their EHR. So just wanted to add that in there.
Yeah, we do have a variety of hospital clients that do use Notify for a few different reasons. So yes, just backing up what Scott said there.
Awesome. All right, man. Next question. When exporting the work list, how many days of past information can be exported?
There will be a total of 62 days available of past information that can be exported at any given time. So the export feature basically corresponds to whatever date range you have. So if you have just when you log in, if you don't play with that date range section at all, like I said, it's going to default to a week. So if you export the list in that current state, it will just export a week's worth of data. If you go back the full 2 months, you will have the ability to see all of that data. So.
Okay, next question. If multiple users of Notify share a subscription and one of those users marks an alert as read or acknowledged, will that icon be displayed to the other users of that work list?
That's a fantastic question. So again, broken up into parts. We want to be careful when we say sharing a subscription. We actually do not allow multiple people to have access to the same subscription. So each subscription is unique to a user account. And since each user account is tied to mostly just one person, they have their own subscription. So the work that you saw, the icons that you saw on my screen just had, they were the result of actions that me as an individual took. That being said, Notify, the one obstacle that we do tend to see sometimes, depending on the workflow and how it's set up, is redundancy in notification checking. So if Scott and I, for example, are both working in the same department and we have the same subscription, we need access to it, then if I look at something, Scott's not going to know that. So it can create sometimes a roadblock. However, one successful, well, actually more than one, a few successful methods that we've seen to combat that are, first of all, the export work list feature. So many organizations now will just have one person who has a subscription. They will then export their work list and kind of break apart the alerts in that manner. We also have the ability to just set someone up with like emergency activity. So maybe Scott's job is just to check the inpatients, and his subscription will only alert him on inpatients, and my subscription would alert me on everything else, or the emergency room or something like that. So there's a few different ways in which we can combat that. But unfortunately, just due to security measures and the architecture of the application, the alerts that you see are just meant in technical terms for the user account, so just meant for you.
All right. Well, we are approaching the top of the hour, Dave, so we're going to call this our last question, buddy.
Okay.
How do you upload or update a patient panel in Notify?
I'm sorry, what was that, Scott?
It's the question was, how do you upload or update a patient panel in the Notify application?
Oh, yeah. So in Notify, what we have, there's two different types of user accounts. The user account that we demoed today is what we call a subscriber account. So that's just basically reserved for all of your end users, folks with, they won't really need any administrative roles. They won't need any of those features. The other type of account that we have, though, is what we call a subscriber admin account. Now, the subscriber admin account versus the subscriber account, they're very similar. Both accounts have the ability to have their own subscription and can look at the alerts. The only difference is the admin account has a little tiny gear that exists in the upper right-hand corner that users can click on, and that brings them to a small admin menu where they can click into the organization's registry. Now, of course, we go through an in-depth training of this process when we're doing the onboarding and the actual implementation, but it is a very simple process. You just basically select the registry that you would want, and then choose or select the registry that you want to update, and then choose the file from wherever it exists in your network or on your computer, wherever the file is. And it's just an Excel file, just a CSV file. So we kind of go through all of that with you and go through the template and how to upload that, but it is a very simple process, yeah.
Well, we're going to call that our last question. I would like to thank all of our attendees today for taking the time to take a look at the Notify application. And Dave, thank you. Great job presenting. We will be posting today's webinar, recording of today's webinar, to the CliniSync YouTube page, and all attendees will receive a copy of the slides via email. We'll try to get those sent out tomorrow. Again, thank you so much, and we hope that you'll join us for some future webinars, and you can watch the CliniSync social media sites for more information on those webinars.